Every morning, millions of people apply creams, lotions, and serums to their skin. We pull a bottle off the shelf and assume that because it is available for purchase, it is entirely safe. Laboratory testing is rigorous, but it takes place in highly controlled environments, using limited sample sizes. A clinical trial simply cannot simulate how a chemical formulation will interact with the unique biology, daily habits, and environmental exposures of millions of different consumers globally. Enter the discipline of cosmetovigilance and toxicologists like Dr. Meera Kapoor. Cosmetovigilance is the systematic, post-market surveillance of beauty products. It is a continuous data collection operation designed to detect and evaluate microscopic adverse reactions before they can escalate into widespread public health crises. Market launch marks the transition from controlled laboratory testing to the real-world stress test of global distribution. Historically, safety teams waited for formal, medically confirmed complaints to arrive via phone lines or doctors' offices. By the time enough paperwork accumulated to identify an issue, thousands of consumers might have already been exposed. That reactive model moves far too slowly for the volume of the modern beauty market. Today, teams like Dr. Meera's take a proactive approach. They deploy artificial intelligence and statistical data mining tools to constantly scrape alternative data sources, reading massive volumes of e-commerce reviews, social media comments, and online forums in real time. They are hunting for a signal. In regulatory science, a signal is an unexpected frequency of a specific adverse event, like a severe rash, burning sensation, or swelling, that suddenly appears within a new demographic of users. This 3D scatterplot visualizes the core statistical concept used to find these issues: disproportionality. The massive cloud of gray dots represents normal background complaints across all cosmetics. But a sudden cluster of bright red dots emerging on the z-axis highlights a specific, concentrated reaction linked directly to just one product. The algorithm flags this data because the reaction is occurring at a mathematically higher rate than observed in comparable products within the exact same category. The system isolates the cluster and calculates a confidence interval to confirm that this is a statistically valid signal, rather than just random online noise. Once a digital signal is validated, it is extracted from the algorithm. The safety team injects this data directly into the company's physical, legal, and regulatory framework for an immediate investigation. Detecting an adverse event cluster does not automatically mean a formula is dangerously flawed. It proves that the surveillance system is functioning correctly, catching a microscopic data trend early and triggering the formal protocol required to protect the consumer. This investigation centers on the product's regulatory core, a massive mandatory dossier known in Europe and the UK as the Product Information File, or PIF. The PIF is never finalized. By law, it must operate as a living document. It has to constantly absorb and integrate the new real-world safety data collected by the cosmetovigilance algorithms. This integration is managed by a cosmetic safety assessor. A highly trained toxicologist like Dr. Anika Sharma has the legal duty to take a new digital signal and translate it into strict biological reality. Her primary focus is the most critical document inside the PIF, the Cosmetic Product Safety Report, or CPSR. Part B of this report contains the ultimate scientific reasoning that justifies putting the product on the human body, bound by the assessor's official signature. Dr. Anika first cross-references the symptoms identified in the signal against the known toxicological profiles of every raw material in the formula. If she finds a chemical correlation, a match between the reported burns and a specific ingredient's potential for irritation, she initiates a recalculation of the margin of safety to verify if the product remains safe under these real-world conditions. If the calculations show that the margin of safety has dropped below acceptable limits, the brand must adapt immediately. They have to either alter the chemical formulation to reduce the risk or print strict new warning labels restricting how the product is used. The PIF and the safety report function as the central nervous system of a cosmetic brand. If those documents fail to actively adapt to new consumer signals, the brand loses its legal right to remain on the market. Updating the regulatory paperwork secures legal compliance, but it only solves half the problem. If the physical supply chain continues to manufacture the product with the exact same error, the danger remains on the shelf. The focus now shifts entirely to quality assurance. Dr. Mira's team launches internal audits and enforces strict vendor oversight, dissecting the manufacturing lines and raw material suppliers to discover exactly why the formulation deviated in the first place. Systemic resolution is handled through the 7-step CAPA process, corrective and preventive actions. The system forces the team to identify the exact root cause, implement effects, and verify the solution actually prevented the error. CAPA ensures companies do not rely on temporary band-aids. It provides a framework to trace a consumer's skin irritation backwards through the supply chain until they find and replace a specific faulty temperature valve in a mixing vat. This level of oversight turns Cosmetovigilance into a proactive risk management strategy. Effective tracking allows a brand to identify and neutralize supply chain failures before they trigger a full-scale market withdrawal. Detect the signal, integrate the data, audit the process, improve the formula. This continuous cycle of invisible, relentless vigilance is what allows a consumer to seamlessly apply a product, completely confident in their safety.